Honorable colleagues, excellencies, distinguished guests, friends, ladies and gentlemen. Bola and a warm Pacific greetings to you all. It is a privilege to join you today. On behalf of the government of Fiji, I warmly congratulate the University of Pennsylvania School of Dental Medicine for hosting this timely conference and for its continuing leadership in sustainability, climate action, and planetary health. Dentistry in a changing world is not just a theme. It is our lived reality. In the Pacific, we are already living on the front lines of climate change. Seas are rising, storms are intensifying, and saltwater intrusion is altering our daily lives. For our small island communities, these are not abstract statistics. They determine whether a mother can reach a clinic or whether a child must endure pain for weeks. After a cyclone, the first building many children search for is the clinic, the place with the light, the chair, and the kind faces that bring relief. When the roof is gone, when water is contaminated, when the generator fails, and the dental chair cannot run, a simple toothache becomes a hospital admission, and a small problem becomes a lifetime burden. This is why we must act together, rapidly and with purpose. The Pacific region cannot address these challenges from within silos. Cross-sectoral collaboration, linking health, water, sanitation, energy, transport, education, and disaster management is the only path toward resilient and equitable oral health. Let me share some concrete examples from Fiji. In maritime regions such as Lau and Lomaiviti, repeated cyclones have damaged clinic and stopped care for weeks. We are now building cyclone-rated, solar-powered, flood-elevated health centers with rainwater harvesting, efficient sterilization, and low-water suction unit, ensuring continuity of care even during disasters. Because our people live across scattered islands, fixed sites alone are not enough. Fiji has deployed mobile dental units and boat-supported clinics with solar-enabled portable equipment to reach schools and our communities. When ferries route or air transport are disrupted, mobile care is not a luxury, it is our lifeline. We are embarking into expanding school-based fluoride varnish and physical programs, integrating oral health into non-communicable disease prevention, promoting access to safe water, and reducing sugar consumption through our national health policy. Prevention remains the most sustainable form of care for people and for the planet. In line with the Minamata Convention, we are slowly phasing down the use of mercury amalgam, improving our waste segregation, and favoring environmentally preferable procurement. Infection control measures are being redesigned to reduce single-use plastics where safe and feasible. Yet a challenge still hangs over all these plans: the workforce. The WHO Global Oral Health Action Plan and the Bangkok and Suva declarations reminds us that a fit-for-purpose workforce is essential. Strategic objective number 3 is clear, that we must build a resilient, sustainable workforce that is evenly distributed, that is competent, and must always be supported. In Fiji, we invest heavily in training oral health professionals over 5 to 6 years, but we often lose talent to higher income countries, and too many dentists remain concentrated in urban centers such as Suva, Nadi, and Lautoka. These imbalances deepens inequity across our rural and maritime zones. Now, to bridge that gap, we are pursuing practical Pacific context solution on integrating oral health within our primary healthcare initiative and disaster response team with dental officers, oral health therapists, physicians, nurses, environmental health officers, and community health workers planning and working together. On expanding the scope of dental therapies, dental hygienists, and dental assistants through competency-based training and regulations so that essential services reach communities where they live. On scholarships tied to rural posting, the hardship or rural and maritime allowances provided, continuing education via telehealth, Poland Pacific Open Learning Health Net, and regional specialist outreach, bringing advanced care directly to where our people live. Now on climate smart competencies, embedding training in emergency preparedness, we have established our FEMET team, green procurement, sustainable infection control, and resilient facility management. Now at COP30 here in Belém, we have an opportunity to unite under one voice. Let us shape a global oral health strategy that complement our national climate adaptation and health security plans grounded in preparedness, prevention, safeguarding, and foresight. Fiji's experience from solar-powered maritime clinics to community-based prevention and workforce innovation, it demonstrates that small nations can lead big change, and we are a living proof that sustainable dentistry is achievable when planetary health and human health are treated as one and the same. Now the question before us is no longer what is the matter, but rather what matters to our people. In Fiji, what matters is that a child on Kandavu can see a clinician after the next storm, that a mother, a grandmother in the Lao group can keep her teeth and her dignity, that our clinics can stand as hub of safety, light, and hope when the winds and sea level water rises. The oral health community has the science. We have the compassion and the ingenuity to meet these moments. Fiji stands ready to share lessons from islands and contribute to the common global agenda, practical, that is equitable, and planetary in its vision. I wish you well in your deliberation in these coming days. Once again, Vinagba Lebu, and thank you for this opportunity.